Namaste. In previous videos, we have covered all the modern aspects of liver disease. Now let's understand its Ayurvedic perspective in detail. Kamala is a Pittajan Anatmaja Vyadhi, which means disease occurs due to the predominance of aggravated Pitta dosha. Also a Rakta Pradoshaja Vyadhi, that means it occurred due to the vitiation of blood tissue. As a result, skin, eyes and mucous membrane takes yellowish discoloration. So in general terms, it can be correlated to jaundice. Another concept is Panduroga is said to be the Nidanarthagara for Kamala. Thus, Kamala can be considered as effect of untreated Pandu or Pandu which runs a chronic course. The word Kamala derived from Kaman Lati idi Kamala. When Kaman means desire, Lati means devoid or diminish. Hence, Kamala is the condition where the individual lose interest in all aspects. Nidana or causative factors are explained in 16th chapter of Charaka Chikitsa, which says if the anemic person indulges excessively in pitta promoting things, the pitta in him gets aggravated, and consuming the blood and flesh, pitta masrik mamsam, in his body leads to further disease. Now let's see the two types of Kamala. Shagashray Kamala, which is Vata Kapha predominant. Second type is Koshta Shagashraya or Bahupitta Kamala, which is Pitta dosha predominant. Shaka means branches, refers to the tissues and channels, dhatus and shrotas, which is beyond the gastrointestinal tract. So Shagashraya Kamala means jaundice, where Pitta has moved from the digestive tract Koshta into the peripheral tissues. Nidana of Shagashraya Kamala are excessive intake of Ruksha, Shida, Madhura, Guru Ahara. Vega Nigraha, suppression of natural body urges. Ati Vyayama, excessive physical exercise. Let's analyze the pathogenesis. Because of the causative factor Nidana Sevana, Kapha dosha becomes aggravated. This aggravated Kapha causes Margavarodha or blockages of channels. Due to this obstruction, Vata gets vitiated, Vata Prakopa. The vitiated Vata in turn expels Pitta dosha from its natural seat, the Amashaya or Pittashaya, gastrointestinal tract, and pushes it outward into the Shakha, peripheral tissues and extremities. When Pitta gets displaced in this way, it manifests as Shagashraya Kamala with characteristic Lakshanas symptoms such as yellowish discoloration of skin, nails, sclera and other tissues. Now comes symptoms of Shagashraya Kamala. Yellowish discoloration of eyes, urine and skin, whitish stools, gurgling sound in abdomen, constipation, heaviness in Hridaya Pradesha. Second type is Koshta Shagashraya Kamala. It is correlated with hepatitis or obstructive jaundice. And what are the main causes to manifest this? Pittakara Ahara, which include excess alcohol, Adhikshara Amla Lavana Sevana, Viruddhahara, incompatible food, Ajirna Bhojana, eating on top of indigestion. Second cause is improper care of anemia. Let's analyze the pathology of Koshta Shagashraya Kamala. Because of Nidana Sevana, there will be Dosha Prakopa, that is Pitta. Then Dosha Samurchana happens. This means this vitiated Pitta causes impurities in blood tissue, Rakta Dushti. It takes Ashraya in liver and spleen and manifests symptoms. At this stage, diagnosis is confirmed. And the symptoms are Haridra Netra, Twak, Mukha, Nagha, Mutra, yellowish discoloration of eyes, skin, face, nails, urine and feces. Beka Varna, discoloration like a frog, that is abnormal color beyond yellow. Indriya Daurbalya, sense organs are impaired. Daha, burning sensation. Aruchi, indigestion and anorexia. Daurbalya, weakness. Balakshaya, body ache. What is Kumbha Kamala? It is a chronic condition of Kamala with main symptoms as the abdomen becomes distended like a water pot or kumbha due to ascites. Kumbha Kamala is almost incurable since it is a grave complication involving Yakrit Pliha and associated with Udara Roga. In modern terms, we often correlate this with hepatic jaundice complicated with cirrhosis and ascites. According to Charaka, Halimaka is another type of severe disease related to jaundice. Characteristic features are yellowing, fever, burning sensation, thirst, dry mouth, loss of appetite, nausea, vomiting, weakness, lethargy, delirium, mental confusion, Halimaka is often correlated with acute hepatitis with possibly acute cholecystic jaundice or viral hepatitis. Lagharaka is mild or early stage hepatitis or cholestasis with moderate jaundice, whereas Alasaka is chronic or complicated hepatitis, cirrhosis or hepatic failure with marked systemic weakness. Another variety is Panaka, explained in Madhava Nidana. It is advanced stage of Kamala associated with fever, diarrhea, yellowish discoloration internally and externally, and whitish discoloration in eyes. It gets aggravated by madhya and heavy food, correlated with alcoholic hepatitis, hepatic congestion, or early cirrhosis. This is the reference from Sushruta explaining the features of complication. Let's see the prognosis. If the symptoms associated with Krishna Pita Shakaran Mutro, black and yellowish urine stool, develops excess edema, eyes and face become red in color, vomit, stool and urine are mixed with blood, and other features like burning, thirst, loss of consciousness, it is considered as bad prognosis. Charaka gives a stepwise line of treatment. First and foremost, Nidana Parivarjana. Avoid causative factors. Avoid excess intake of sour, salty, and alkaline food as well as mental stress and physical strain. Next, Shodhana, purificatory therapy. If the patient is strong and digestion is good, Virejana, purgation is the main purificatory therapy. Trivrit Churna, Abhipattigara Churna, or Draksha based mild purgatives may be used. It helps expel vitiated pitta from the system. And then Shamana, palliative therapy. After purification or if the patient is weak, use Deepanapajana drugs to kindle digestion and correct metabolism. Then administer Rasayana and Rakta Prasadaka, blood purifying and enriching herbs. In case of Shagashray Kamala, Kafahara Chigitsa should be done, followed by Katu Tikshna Ushna and Lavana Chigitsa. Gomutra and Grida Prayoga is indicated to bring doshas from Shakas to Koshta and pacifies Pitta dosha. How Gomutra is used in Kamala? The reason is in Shagashrida Kamala, the doshas are stagnant in tissues. Gomutra, being Tikshna and Sukshma, mobilizes these lodged doshas and pushes them back into Koshta, making them ready for expulsion. It also stimulates Agni and acts as mild bioenhancer, helping drugs penetrate deeper. Hence, Gomutra acts as dosha prajalaka. It dries out morbid pitta from the tissues back into the gut. Halimaka Chikitsa start with Snehana Karma, followed by Mridu Virechana, Vata Pitta Nashaka Aushada, and Madhura Anna Sevana. Also, Yapana Basti, Agni Sandibana helps in this condition. So in total, Shodhana and Shamana are the treatment options. Let's see some choice of drugs in Kamala Chikitsa. In Grita, the options are Panchagavya, Mahatiktaka, Kalyanaka, Dadimadya Grita. Gutika options are Arogyavardhini, Chandraprabha, Live 52. Kashayas are Vasa Gudichadi Kashaya, Patola Kadurohiniadi, Bringarajasava. The drugs are based on individual patients according to the symptoms and condition. In Kamala, single drug treatment are very effective. Even in folklore medical practicing, there are a lot of Ekaushada Prayoga for Kamala. Some examples are Bhumyamalaki, Katuki, Guduchi and Bringaraja. The diet which specifies the symptoms are Draksha, Papaya, Dadima, Purana Shali, Gokshira. The dons include Snehana and Swedana, Raktamokshaka, Vegadharana, Madhura Rasa Pradana Ahara, Snigdha Guru Kafahara Ahara, Vyayama and Maithuna. This is about Ayurvedic aspects of liver disease. If you have any questions, drop a comment below. Check out the liver related topics and subscribe for more health related videos.